This is some of the MCQs in medical surgical nursing. Some questions which are very important in cardiac nursing and for various competitive examinations. First question. Dyspnea in right or left decubitus position is referred to as options A. Tripopnea, orthopnea, platypnea, apnea. Dyspnea in right or left decubitus position is referred to as tripopnea. Tripopnea is usually associated with diseases of the lung, especially one lung or one bronchus. That is why only one position is affected, either in right or left decubitus position. Dyspnea in right or left decubitus position is referred to as tripopnea. Next question. Dyspnea in recumbent position is referred to as, that everybody knows, it is called orthopnea. Orthopnea is discomfort when breathing when lying down or flat. It is seen in cardiac or lung conditions. Central synopsis is noticed when capillary concentration of hemoglobin is less than 4 gram per deciliter, 10 gram per deciliter, 8 gram per deciliter, 11 gram per deciliter. Right answer is 4 gram per deciliter. Central cyanosis, it's not synopsis, it's cyanosis, CYANOSIS, is noticed when capillary concentration of hemoglobin is less than 4 gram per deciliter. Next question. Central cyanosis is seen when oxygen saturation is less than 85%, less than 75%, less than 65%, less than 60%. Central cyanosis is seen when oxygen saturation is less than 85%. Dyspnea in upright position is called platypnea, orthopnea, apnea, tropopnea. Dyspnea in upright position is called platypnea. It is the shortness of breath worsened by standing or sitting and improves when lying supine. That is platypnea. Which finger is best to feel pulse? Index finger, thumb, middle finger, little finger. Index finger is best to feel pulse. Pulse deficit is referred to as difference between apical beat and peripheral pulse, difference between radial and ulnar pulse, difference between lower limb pulse and upper limb pulse, difference between temporal pulse and distal pulse. Pulse deficit is referred to as difference between apical pulse and peripheral pulse. Pulse deficit is said to be significant if it is, we have already discussed, pulse deficit is difference between the peripheral pulse and the apical pulse. It is said to be significant when it is less than 10, less than 20, less than 15 and less than 25. Right answer is less than 10. Pulse deficit is said to be significant if it is less than 10. What is the other name of water hammer pulse? Corrigan pulse. Pulse is paradoxus, dicrotic pulse, thready pulse. The other name of water hammer pulse is Corrigan pulse. Why SA node is called pacemaker of heart? Because of poor cholinergic activity, rich sympathetic activity, generating impulse at higher rate, capable of generating impulse. The right answer is it is capable of generating impulse and it establishes basic rhythm and rate of the heart beat. That's why it is called a pacemaker of the heart. Rise in carotid sinus pressure leads to, if there is rise in carotid pressure, it leads to reflex bradycardia, reflex tachycardia, reflex hypercapnia, reflex hyperpnea. The right answer is reflex bradycardia. What is the action of adrenaline? It increases the uptake of oxygen by the heart. It increases the contraction force. It decreases the myocardial irritability. It increases the heart rate. The right answer is it increases the uptake of oxygen by the heart. Thank you for patient listening. If you are watching the channel for the first time, please subscribe the channel, share it to your friends, like the video and comment the video. Thanks for watching. Bye.